Mr. Jenrick. Always good to see you, particularly at this early hour. We've got lots to talk about on your brief, but can we just start with the issues, such as they may be around vaccination? Why has there been an instruction, a change to the schedule in terms of vaccination? How much of a delay do we see being built into the system?
Well, we do think there are going to be some supply issues in the weeks ahead, but this isn't anything that people should be worried about. We're still on course to meet our targets. That's to vaccinate all of the groups 1 to 9 by the middle of April and all adults to receive their first vaccine by the end of July. Nobody who has an appointment should be concerned. You're still going to get your second vaccine, and all those appointments will be honoured. But we always said right from the beginning that a new manufacturing process would have its lumps and bumps, and that has been the case in the past, and I'm sure it will be in the future. We're sourcing vaccines from all over the world, and we are experiencing occasionally some issues, and that's led to this issue with some supply in the coming weeks. But as I say, the main thing is we're still very much on course. We've still got line of sight to deliver the vaccines and to meet our targets.
Just to be really specific, and indeed on something you just mentioned there, problems in obtaining the vaccine from around the world. There's a suggestion this morning that perhaps the issue as regards the AZ Oxford vaccine is a problem in India, where they do produce. Is that your understanding?
Well, I'm not going to get into the specific contracts that we have with different manufacturers. We're sourcing vaccines from many countries all over the world. It's a very complex international supply chain. And as I say, that does mean occasionally we will experience issues. And that is what we've experienced right now. But there is no reason to be concerned. We are on course to meet our target, which is to get those first categories of 1 to 9 vaccinated by the middle of April. And that was always a challenging target. Remember, we only met our target in mid-February with a couple of days' grace. And so the targets the Prime Minister has set us are not easy ones, but we are on course to achieve that one. And myself, Matt Hancock, Nadeem Zahawi, the government, we have line of sight that we've got enough vaccines to do that. And so that's the main thing, and that's what we're focused on right now.
Indeed, and of course, as you allude to, the Health Secretary yesterday in Downing Street made it very clear that those deadlines, those targets would still be met. There is a little bit of concern, though, on whether or not this might have some impact on the roadmap itself. I mean, is the roadmap actually based on those kind of confirmed vaccination targets, on those dates that the Health Secretary still stuck to yesterday?
Well, the vaccine rollout is our route out of this. The more people we vaccinate, the easier it will be to open up our society and get us back to the way of life that we all want to see. There's no reason to believe that the roadmap is affected by this temporary shortage in supply. The main thing is that we are on course to meet the targets that the Prime Minister set us of getting the categories 1 to 9, which is all the over 50s, including the clinically extremely vulnerable below that age, vaccinated by the middle of April. So there's no concern that we're off course with the roadmap. Sure.
Just one last question on the vaccine, and it is a distance from your brief, so you may well not know this. But does the Moderna jab start coming into circulation in April?
I don't know, to be honest, the exact date that the Moderna jab will be in use within the UK. Obviously, we have the orders placed, and we'll be using them as quickly as they come into the country.
Actually, apologies, Secretary said. I inadvertently misspoke there. One more question on the vaccines. What do you make of the sabre rattling that we're seeing from, amongst others, Ursula von der Leyen, the threat that somehow the EU could have a rather spurious interpretation, to my eyes at least, of Article 22 and intervene in vaccinations, in delivery of vaccines that we have bought, that we have paid for, that are on a contractual basis ours, that the EU might step in to intervene there?
Well, I was surprised and disappointed by those comments, but the Prime Minister had spoken earlier in the year to Ursula von der Leyen, and she gave a very clear commitment, which was that the EU would not engage in this sort of activity, that contractual responsibilities would be honoured, and that's exactly what we intend to do. And I hope and expect the EU to stick to their side of the bargain as well. It isn't at all helpful if we enter into this sort of conversation. That's not the way the UK is behaving or wants to behave in the future. We all need to work together to get through this. supplies of vaccines rely on very complex international manufacturing supply chains, as we've just said, and so everybody needs to have free trade of vaccines and not get into this sort of difficulty.
Talk to us a little bit then about rough sleeping. The rough sleeping accommodation programme, of course, did serve to take thousands of people off of the streets at a time when, everyone was very, very concerned about the spread of the pandemic. We certainly knew a lot less. And we're moving on to kind of the second stage of that now.
That's right. A year ago, almost to the day, we launched Everyone In, which had a simple objective of asking those people who are sleeping rough on the streets and most vulnerable to COVID-19 to come into safe and secure accommodation. It was hugely successful. We ended up bringing in over 37,000 people who are either sleeping on the streets or in otherwise pretty precarious situations like sofa surfing with friends and relatives. Most of those people have now been able to move on into better accommodation, either social housing, the private rental sector, or what's called move-on accommodation, which is temporary with accommodation with wraparound care. About 27,000 people have been given that sort of help over the course of the last year. But we've still got many people in temporary emergency accommodation. And today we're putting in place further support so that we can build up good quality accommodation to help those people to access it and begin to rebuild their lives. We've secured over £400 million, and today we're releasing the next 200 million of that so that charities and local councils across the country can invest in up to 6,000 new move-on units over the course of this Parliament. And that will give us a new national asset of accommodation so that if people are sleeping rough, they can be moved on, given a home, and then begin to rebuild their lives, get help for substance abuse, mental health.
There will be no one who is sorry, apologies, Minister, we've got a finite amount of time. There will be no one working in this sector that will not welcome additional money. Of course, they will welcome additional money. The question is whether or not it goes quite far enough. I mean, the statistics, as you were mentioning there, 37,500 people, in essence, helped in as a result of Everyone In. But that figure, there is obviously going to be a disparity, but that figure of 37,500 is a country mile away from your department's own estimates of how many rough sleepers there were in the country. It was roughly 4,300 in March 2020. I mean, you've been on a bit of a learning curve here, but are we still on course to eradicate homelessness by 2024?
Yes, I think we are. By that, we mean that nobody should have to sleep rough on the streets. I think we've learned from Everyone In that there will always be some people who do, for a variety of complex reasons, even at the height of the lockdown last spring, when we asked everybody in the country who was sleeping rough on the streets to come in. We still found a small number of people who chose not to. But our objective is that there is good care, that everybody is offered accommodation within at least a night or so of being seen on the streets. And that is what we're working towards. We made huge progress. Last year, the number of people sleeping rough on the streets fell by about 37%, according to the statistics that were published a month ago. That's a major step forward, but there will be big challenges ahead. And the strategy that we are putting in place is not just one of housing, but it is also one of health, making sure there is proper support for people for their mental health and for substance abuse, which is a really significant factor in why people end up on the streets and then the issues that they face when they're on the streets.
OK, Minister, just before we wrap up, there's a policy initiative, I think, from Priti Patel that will raise a few eyebrows doing the rounds this morning. A few reports that asylum seekers could be sent from the United Kingdom. Asylum seekers who have arrived in the United Kingdom could be sent to third countries to have their asylum application processed. What is the thinking behind this? And in what way will this deter people from making the journey to the UK in the first place?
Well, this isn't an announcement by the Home Secretary. This is speculation on work that she is doing and will be saying more on in the weeks ahead. So I can't give you all the answers this morning, but it is extremely important that we have a robust immigration system and that those people coming to the country to seek asylum can do so in safety. We don't want anyone's lives to be put at risk. We don't want people to be at the hands of people traffickers. We've seen people, including young children, dying making perilous crossings across the Channel. That isn't something that we want to see. And so if there are safer and better ways of doing that, then we should be exploring them. And that's exactly what the Home Secretary is doing.